Hey everyone, this is gonna be my first rant. I am really stressing out, and actually my husband had told me to go ahead and talk about this as a suggestion. So, right now I am trying to get off a very potent opiate pain medicine called fentanyl, and I'm on the patch. And I've been on it since February of 2000 for chronic pain. I have arthritis and 2 injuries. Anyway, it's really, really freaking hard to get off this shit. Let me just fucking tell you how hard this is. I've been through a lot of things and a lot of difficult physical ordeals, and honestly, nothing compares to this hell I'm in right now. I've been trying to get off for about a year now, and thankfully, I don't have any of the addictive sequelae. I just have physical dependent symptoms, so I don't have mad cravings or anything, and I don't want it or whatever, but the physical withdrawal is just torture. There is nothing like this. And it's funny because in medical practice they'll tell you, oh, opiate withdrawal's like the flu. Okay. Bullshit. Bull fucking shit. That is the most insipid understatement ever. And if this is how bad it is physically, I am absolutely dumbfounded and find it incomprehensible how somebody who is addicted to opiates too, with all the mental shit, could go through this. I mean, I don't have the craving shit, I don't have the vivid wanting dreams, I don't have clock watching and weird drug seeking, all that fucked up shit. All I have, as if it's not that much, is the physical shit. So let me try and explain what this is like. Yes, it's kind of like the flu, but that's only part of it. Aching joints, muscle pain, muscle spasms, tingling hands and face, cold, bone fucking chills, and then sweating like you're feverish, and the pain is so increased because your tolerance for pain goes way down when those receptors that have been continuously blocked for 10 fucking years all of a sudden are open, and hyperalgesia, yeah, it's messed up. Anyway, yawning, crying, tremors, morbid fucking inconceivable depression, nausea, vomiting, diarrhea, cramping, twitching, fucking brutal agitation. This is the part that's the hardest for me. It basically feels like a low-grade panic attack, or if you've ever been put in a stressful situation and you feel your heart beating hard from the adrenaline. It's like that, but all the time. And look up dysphoria, because that fits too. Dysphoria, the opposite of euphoria. Most people have heard euphoria. It's like the greatest feeling in the world. Dysphoria is the worst feeling in the world, and that is not an exaggeration. This is fucking brutal. Oh, and sleep? No. There's no sleeping in opiate withdrawal. You can be up for days. Literally. You're so fucking exhausted and spent and sick, and all you can do is fucking writhe in agony. You can't relax. You can't be still. I'm not fucking kidding. It is impossible. It is physically impossible to relax or remain still. And it comes in these fucked up waves, like every couple seconds. Like, you'll be in bed and you're just nauseous and hurting and miserable, and this fucking tension wave of like tickling adrenaline rush shit starts in your belly, and you have to move or contract your muscles or something, and that'll make it go away for a couple moments, 2 or 3 seconds, and then it happens again and again and again, and there's no fucking peace. I've been in contact with 2 individuals who are heroin addicts, and both said getting off fentanyl is worse. Fentanyl is much stronger than morphine, number 1, and number 2, even people who use heroin have peaks and valleys in their drug level. So the desensitization is not as extreme as it is with transdermal infusion with a patch, which is what I use. For the past 10 years, my opiate receptors have been saturated with this drug 24/7, 365 plus leap years. I was on 200 micrograms per hour, which is a pretty fucking big dose. And the good news is I was able to function as far as the pain. You get tolerant to the more annoying side effects of opiate therapy: nausea, fatigue, somnolence, respiratory depression. One symptom that you don't get tolerant to is the narcotic bowel effect. The constipation sucks, but for me that's a non-issue because I'm malabsorption, and that's a whole other story. But anyway, many people have been restored to life on these medicines. They are excellent, excellent drugs, and it's a damn shame that there's so much opiophobia in medical practice, because the ones who are addicted are so deceiving and so manipulative and so insidious, and they taint a clinician's outlook on prescribing opiates. There's a great deal of hype about how dangerous and drug-seeking behavior, and the fucked up thing about pain is there's not always a visual indication. The only way to assess pain is to ask the patient, and that makes doctors uncomfortable. But the facts are, less than 1% of people prescribed opiates get addicted, okay? It's not common. If you want more information, check out partnersagainstpain.com. It's a great education website. So let me just say now, I'm in full support of opiate therapy. My getting off is entirely volitional. My husband and I want to try and have a baby, and I refuse. I fucking refuse to conceive, carry, and birth an opiate-dependent child. That is just so fucking wrong. In my opinion, I understand that some people do it. We went to a high-risk perinatologist, obviously, because I'm very ill, and people do it, okay? Like, the perinatologist was basically like, yeah, it can be done, then you wean the baby off. I'm not down. I also had a rare side effect from the opiate therapy called hypothalamic hypogonadism, and basically my hormones shut down and it was like premature menopause, lost all my hormones, and therefore totally infertile. And we don't have the money to pay a surrogate. We won't qualify for adoption because of our medical issues. So basically, our only option is for me to try. So yeah, this has been years in planning, getting me in the condition, and the two biggest things I have to do are get off this medicine and quit smoking. They do have meds to help people get off of opiates. The most controversial but quickest method is called the Wiseman method. There's an anesthesiologist named Dr. Wiseman who came up with a treatment where the opiate-dependent person is put under general anesthesia, and then their system is flooded with an opiate antagonist, which cleanses the opiate receptors of any narcotics, and you go through rapid withdrawal, and you're knocked out for it, so you don't feel or remember, and then you wake up and you're done. Hasn't been very effective for drug addicts because the craving is still there, and so they're very, that it's too easy to relapse. But for people like me who just have the physical dependence, it'd be a great solution. Unfortunately, it costs $8,000 for that program. Alright, I'm about to be done with my 15 minutes here, so I'll make a part 2 about this. Thanks for listening.